A system of voluntary, regular, non-remunerated blood donation is critical for quality blood service delivery. The IFRC recognizes that health security is a fundamental and indispensable prerequisite to global, national, and individual development, and supports the advancement of global health security by promoting voluntary, non-remunerated blood donation and advocating for the safe provision of blood and blood products, as spelled out in its current Strategy 2020. Saving lives, changing minds.
The safety and integrity of national blood supplies are fundamental to health security. The IFRC either provides or assists in the provision of at least 1/3 of the world blood supply. We thus have the responsibility to ensure the blood and blood products provided by Red Cross and Red Crescent are as safe as can be following government standards and requirements.
We fully recognize the importance of supporting national societies with safe and sustainable blood programs. In 2001, the IFRC established the Global Advisory Panel on Corporate Governance and Risk Management of Blood Services in Red Cross and Red Crescent Societies, GAP, which is an independent association comprising of experts from national societies. This panel of experts is now available for national societies requesting technical expertise in all aspects of corporate governance and risk management. We are committed to providing support to national societies in 3 key areas: knowledge sharing, networking and partnerships, tools and guidelines, and technical advice. In the area of knowledge sharing, networking and partnerships, GAP's main tool when working with national society blood services, it's the self-assessment questionnaire. The self-assessment assists national societies to ensure that appropriate steps are taken to support the sustainable stability of a blood service without exposing the society to any unnecessary risks. In the area of tools and guidelines, GAP's Blood Manual provides firm information and knowledge on how a sustainable, safe blood program can be maintained. In the area of technical advice, GAP supports national societies in discussions with their Ministry of Health in regard to corporate governance arrangements. GAP provides strategic planning support to assist national societies address and manage key risks. GAP provides assistance in seeking appropriate indemnity for risk.
In September 2011, the IFRC Governing Board approved a policy to promote safe and sustainable national blood systems. The policy sets out the scope of Red Cross and Red Crescent blood-related activities, as well as roles and responsibilities related to the management of associated risks. It recognizes the important contributions to health and the humanitarian act of blood services and blood donation. The new policy highlights that the final responsibility for safe blood and sufficient blood supply lies with governments. It is their responsibility to define appropriate standards and to ensure sufficient funding mechanisms for national blood programs and services.
National societies may be involved in blood-related activities at 3 levels. While it is the responsibility of a country's government to ensure an adequate and safe blood supply, many national societies play an important role in supporting their government to achieve that objective.
It is important that national societies consider carefully the level of blood activities which is most appropriate for their engagement.
The risk of disease due to unsafe blood can substantially be reduced through an integrated approach to blood safety. National societies involved in blood services should have a clear mandate, have the necessary capacity, and be able to manage any legal liabilities. The IFRC is committed to increasing the number of national societies supporting voluntary blood donation as a key contribution to achieving the Millennium Development Goals.